Hi, my name is Dr. Ross Hauser. Welcome to the Hauser Neck Center here in Fort Myers, Florida. Perhaps the most common or one of the most common neurologic conditions that we've all seen is tremor, and we've all been at restaurants or had older relatives who started to shake their head, or they would go reach for something and then all of a sudden they would get tremulous. Fortunately, I don't have tremors except when my wife tells me we got to talk. Talk about tremors. But essential tremor basically means the doctors don't know what's causing it. And you guys know from Hauser's law is if a physician or somebody has a symptom, disease, disorder, condition, and nobody knows the cause, if you follow the neurology will normally lead to ligamentous cervical instability. So you might say, well, how does that relate to brain diseases? Or if somebody has Parkinson's, Alzheimer's, or tremors, and those two conditions are associated with various tremors, and they can even have essential tremor. If the brain is having a struggle, then what's the closest joint to the brain? That's going to be the upper cervical region. And upper cervical instability and destruction of the neck curve can lead to jugular vein compression, which we'll talk about. And obviously, if somebody's brain pressure gets high enough, anything in the brain can go haywire. Now, if you want to know, does somebody have an essential tremor? And this says neurologic disorder that causes involuntary and rhythmic shaking, which most affects the hands. You could have somebody draw something. Like recently, I had somebody who I suspected had Parkinson's disease. So I had them write something because with Parkinson's disease, you tend to take smaller steps and you have micrographia, which means you write very small instead of writing the normal amount. This person is just trying to make this, but it looks like that. So that's what happens with an essential tremor. Essential tremor is one of the most common movement disorders and is typically marked by tremor in the upper limbs, but also may involve the head, voice, lower limbs, and trunk. It affects 2% of the population, so it's obviously a very common disorder. 57% are females. It's associated with a lot of other medical conditions. And one of the main ones is dystonia. So dystonia is where there's a tension in the neck. Somebody might say, well, are there any clues that my tremor that nobody knows the cause is from the neck? Well, do you have clicking, popping, grinding in the neck? Do you need to get chiropractic care to feel better? Is there other signs or symptoms associated with cervical instability, such as tinnitus, migraine, tension headache, ringing in the ears, vertigo, digestive problems, all the other things, head pressure that I talk about in other videos. Now, the most common treatments are substances that calm the nervous system down, and we're going to talk about these substances normally affect the GABA system, so keep that in mind, the GABA system, which we'll talk about later. About 40% of people who get on medications for essential tremor, they get off of them within 2 years because they don't work as well or they don't work. Now the question is, if a medication is working and then all of a sudden it stops working, what's the cause of that? Because I want you just to think about that. So if you got on a medication, even if it's a diabetic medication or any medication for a condition and now it's not working, why is it not working? Well, I would say the reason why it's not working anymore is that your condition is progressive. So what condition would be progressive that could affect the brain? I would say that's going to be intracranial hypertension, high brain pressure. Because if somebody isn't working on their neck curve, getting their neck curve better, or if they got clicking, popping, grinding in the neck, and you're not doing something to try to stabilize the neck, like exercises or prolotherapy, then like a screw that's loose on a hinge, every time you open and close the door, the hinge gets looser, so the next screw gets loose, then that hinge gets loose, then the next hinge gets loose. Now the door is jingling all over the place. So much like if you have tension in your neck up here and you don't do something about it, that's going to resolve the instability. Well, it's going to keep progressing. The intracranial hypertension is going to progress. The increase in brain pressure is going to progress, and then there's worse and worse tremor. In medical school, we used to call Propranolol end it all. And I'm not saying that it's not an effective medication for certain things. It's just that propranolol, indorol, beta blockers, they block the adrenaline system. They decrease sympathetic hyperactivity, so that part's good. But we used to in medical school call it end it all, because you just usually get kind of depressed from it because your pulse rate always stays low. So imagine if you could never raise your pulse rate. It means whether you're at a game or you're getting excited or you're walking or you're exercising, and it slows your metabolism down, which again would be why it probably helps essential tremor, because essential tremor, or almost any medical condition, when a person is under stress or they feel a lot of stress, the condition gets worse. So if you're on something that limits your heart rate ability to go up and it suppresses the central nervous system, well, yeah, the tremor might get better, but how is the rest of your life? Are you more depressed? So tremor is involuntary and rhythmic. It's basically always pathologic. It means that there's something wrong. It's a chronic progressive neurologic disease whose main symptom is tremor, which is typically postural and kinetic, which we'll talk about. So almost all tremors, and here we're talking about essential tremor where you don't know the cause. Like in Parkinson's, you get a pill rolling tremor, which is different than essential tremor. So basically, essential tremor, 95% in the hands, 34% in the head, 30% can be the tongue. You can get tremors in the tongue, tremor in the voice, tremor in the chin, the face, the torso. It increases with age. 7% of people over the age of 65 have essential tremor, 11% over the age of 80. It's associated with a lot of other symptoms, including cognitive decline, apathy, depression, anxiety, sensory issues. You can have hypersensitive hearing, smell. You can have insomnia. Many people believe it's neurodegenerative, just like Parkinson's and Alzheimer's, where there's certain parts of the brain that are degenerative, meaning that there's nerve cells that have been destroyed, there's atrophy in the brain. You see that a lot with essential tremor. And like I said, 30% of pharmaceutical treatments are completely ineffective. Propranolol is about 50% effective, but by 2 years, the discontinue rate is 40%. There's different ways to characterize it. Resting tremor means I'm sitting here and I'm going like this. Action tremor is you're trying to do something, like you're trying to feed yourself. You might see at a restaurant where somebody's trying to feed themselves. Postural tremor is tremor that is present while voluntarily maintaining a position against gravity. Kinetic tremor, that occurs with any voluntary movement. And again, essential tremor means the doctors essentially don't know what is causing the tremor. And by Hauser's law, if you follow the neurology will lead to ligamentous joint instability, and when the brain's affected, that normally involves the neck. So when you do brain imaging, what does it show in essential tremor? Neuroimaging techniques in essential tremor give insight into the pathophysiology. it indicates the involvement of the cerebellum as the most consistent finding. Specifically, there's hyperactivity in the cerebellum. So we'll obviously talk about the cerebellum. There's other findings in the motor tracts. The motor tract is just what controls motor movement in the human body. Normally, most studies have shown a decrease in gray and white matter volume in the cerebellum. In the brain, the gray matter is basically the DNA, the cell bodies. The white matter is the axons, or the axons are basically what bring the sensory information to the brain. The supplemental motor area, the medial premotor cortex of the brain, actually increases in gray matter and activity, and often correlates with tremor activity. So basically, tremor is, in summary, is caused by an injury or a dysfunction of the cerebellum, and the cerebellum is what inhibits or fine-tunes motor activity, which we'll talk about. I'm going to show some quick slides here. I'd really encourage anybody who's interested in more detail about the role of the cerebellum in tremor. And this just goes through the various motor tracts, and if you'll see that the cerebellar changes in essential tremor are similar to the cerebellar changes in Parkinson's disease, which are somewhat similar to the cerebral changes in dystonic tremor. Somebody who has tension in the neck and then has a tremor, again, the dystonia, or the tension in the neck causing the neck and the head to move, because one could see where if there's abnormal muscle tension in the neck, so say you always felt tension on the right side of the neck, you could see where, you might be moving your neck subtly. And because ligamentous cervical instability is a progressive disorder, for instance, somebody hits their head, they injure some ligaments in the back of the neck, obviously those segments are loose, then the force to hold your head up is going to go to the next vertebral segments, so it ends up progressing. Now I just put this in here, so we talked about drug treatment for essential tremor, and there's neurosurgeons that put in these deep brain stimulators. So for very, very advanced Parkinson's, or really advanced tremors, doctors will put in probes, and you could see where the neural stimulator is placed in the chest to basically inhibit the tremor. So they put them in the thalamus in different areas. And I just put this for completion's sake. I've never had a patient who's needed a deep brain stimulator, and I'm not saying that all the tremor patients that we get at Caring Medical all improve 100%, but we do have a lot of people who improve a lot, and some people get complete resolution of the tremor. So the cerebellum is in the back of the brain. That's the part of the brain that's affected the most by, or affected the most when they study essential tremor. So there's the cerebellum. You could see its relationship to the brain stem, the spinal cord there. So the cerebellum contains only 10% of the brain volume, but it contains 50 to 80% of the neurons of the brain. It is part of the brain that affects motion. It modifies motor commands, like for instance, you want to walk, you want to stand up, you want to move, making the movements more accurate. So it's involved in coordinating fine movements of the body. You might say the cerebellum is similar to the vagus nerve in the body. You've heard me say the vagus nerve is primarily inhibitory, meaning that it slows the heart rate down, slows the body down, so the body can restore, recover, regenerate. So the cerebellum fine-tunes motor movements like learning to hit a golf ball or baseball, or even when a kid's trying to write. Like, you don't realize, how coordinated writing is, or a lot of the tasks that we all do working on the computer. And so the The cerebellum, like the vagus nerve, is inhibitory. The autonomic nervous system, if the vagus nerve doesn't inhibit it, you get sympathetic hyperactivity and the heart rate goes crazy. You know, the heart rate goes up to 170 to 200. We have patients who have vagus nerve degeneration and they get ventricular tachycardia and terrible, terrible things. And wouldn't you agree that most people, it's almost like their brains are way too active. Like they can't shut off the brain. And you're gonna learn today why people drink, why people take marijuana, why people take benzodiazepines. You know, they're just trying to shut off the brain, and many of those things stimulate the GABA receptors. And the cerebellum, when it's activated and it's healthy, it activates the GABA system to help make motion very smooth. Now, these are some of the things that we see in the office. You can see right here where this is McRae's line would be right here. This is the opening of the brain. You could see where the cerebellar tonsils, this is part of the cerebellum, it basically, the brain has sagged into the hole through which the spinal cord goes. And basically, this cine scan shows that the cerebral spinal fluid is getting blocked. If you look at here, any sort of obstruction of the cerebral spinal fluid, and the cerebral spinal fluid is here is white, so any obstruction of the cerebral spinal fluid anywhere in the neck, you're going to see that the white portion here on an MRI, it gets bigger. And where it gets bigger often is the cerebellum. And you can see on this MRI, the cerebellum is just covered with white. So you can imagine if you get an obstruction of the cerebral spinal fluid because of cervical dysstructure, a breakdown of the cervical curve, or upper cervical instability, the primary area, or one of the first area that's going to be affected by it, is the cerebellum. And obviously, if the cerebellum has too much pressure on it, there's going to be dysfunction of the cerebellum. Then the brain isn't going to have the inhibitory input that it needs. Then you're going to get movement disorders. Some of these movement disorders can be dystonia, and dystonia can be in any limb, and you can get all different kinds of tremors. And this again shows cerebellar tonsillar ectopia there. So post-mortem studies in patients with essential tremor demonstrate a 30 to 40% loss of Purkinje neuron cells. The most definite evidence for Purkinje cells is its major role of the cerebellar circuit in motor coordination, more precisely defined as the ability to fine-tune and course correct a movement in progress. So basically, when they've done studies in people who died and had essential tremor, the cells, Purkinje cells, go to the cerebellar cortex and they're inhibitory, so they help coordinate motion. So you can't just have, like, I want to kick my leg, you know, I want to kick a ball. Yeah, when you decide you're going to kick a ball, there's going to be certain muscles that are stimulated, but you need other muscles inhibited, right? Right? You can't, otherwise you wouldn't be able to move. I know it sounds kind of weird, like it's inhibitory toward motion, but you get the thing. If I'm going to go like this with my biceps muscle, the triceps muscle has to be inhibited. You know, so in the brain, the part of the brain that affects that does the inhibition is the cerebellum, and it does it through the GABA system. And again, these Purkinje cells, they go to the cerebral cortex, and you've seen me show many times how intracranial hypertension, it really affects the cortex. So it's affecting these Purkinje neuron cells, and they're dying, and then you end up getting motions that aren't coordinated. Like when you get cerebellar disease, you get this thing called ataxia, and the limb just goes like this. Or sometimes when you do finger to nose testing, the person goes like this, and those are signs that you have incoordination of fine motor movement. Another thing is this, can you do this? And if you can't do this very well, you might be starting to get cerebellar problems. Gamma aminobutyric acid is GABA. GABA deficiency is associated with a lot of diseases: depression, insomnia, alcohol dependence, anxiety, and panic. There's two different kinds of GABA receptors, alpha and beta. Basically, they affect the chloride channel in the brain. GABA acts as an inhibitory manner. It is a switch mediated by the chloride cation transporter expression in the brain. It's an amino acid that functions as the primary inhibitory neurotransmitter for the central nervous system. It functions to reduce neuronal excitability by inhibiting nerve transmission. In the brain, this is important, fast inhibitory neurotransmission is mediated primarily by the ionotropic subtype, meaning stimulatory, of the GABA receptor subtype A. GABAergic neurons are located in the hippocampus, thalamus, basal ganglion, hypothalamus, brainstem, cerebellum. The cerebellar stimulation increases GABA concentrations. That's kind of a key point. The most definitive evidence for Purkinje cells, a major role of the cerebellar circuit in motor coordination, which I said before. Now, this is a really interesting point. Most of the things that people take, alcohol, benzodiazepine, barbiturates, GABA hydroxybutyrate, which was known as the date rape drug because it was so good to get a person's sleep that it could knock you out, Lyrica and gabapentin, and then nowadays in anesthesia, especially in surgery centers, they use propofol. Those all stimulate the GABA system. So if you think about it, like, why do people drink excessively? Or why do people get addicted to benzodiazepine? It used to be that people would take a lot of barbiturates. Then we have so many people on Lyrica and gabapentin, right? You probably, a lot of people watching this. So there has to be something with the GABA system. So there's something with the GABA system because these drugs work on the GABA system. So the GABA system is the inhibitory part of the brain. So when you stimulate the cerebellum, it increases the GABA in the brain, and then you get the inhibition and the brain gets more restful, right? These things, like, why do people drink? Why do the people drink? Because the brain needs a rest. Why do people take Valium or Xanax or clonazepam? Why are people taking gabapentin or Lyrica? Because the nervous system is just going crazy, right? Somebody has a tremor, the brain's going crazy. Why is the brain going crazy? Probably because the cerebellum's getting destroyed and other parts of the brain are getting destroyed. When we say destroyed, that means neurodegenerative. And because it's a progressive disorder, you don't have cases where somebody has an essential tremor typically, or they're getting Parkinson's disease, and then all of a sudden it goes into remission. Like, we all know people, like, it gets worse and it gets worse and it gets worse. Why? Because the underlying destruction of the brain is getting worse. Why? Because the jugular veins are getting compressed, which we'll talk about. Well, I guess we'll talk about it now. So the normal jugular vein is supposed to look like that. So you can imagine if somebody's sleeping and the jugular vein looks like this, it's just a sliver. The jugular vein is the main port to drain the brain. So if that port is closed off during sleep, all that's going to happen is the brain pressures go up. And one of the main reasons that we sleep is the brain is supposed to drain, detoxify, get rid of toxins. And throughout the night, the brain metabolism slows and the brain pressure goes down. So if that isn't happening, what's going to happen is the brain pressure goes up, brain pressure goes up. As the brain pressure goes up, different parts of the brain are going to be affected. There can be neurodegeneration in structures such as the cerebellum, and then you get tremor and other movement disorders. So the jugular veins are in their shortest position when a person has a normal lordotic curve. And we all know that we're all addicted to cell phones, and when you look down at a cell phone, you stretch the ligaments in the back of the neck, and you eventually lose the neck curve, and you can get all kinds of crazy cockamamie curves and even a really severe reversal of the curve. Ultimately, what happens is the jugular vein gets compressed, and the cerebral spinal fluid, which is the fluid that nourishes and bathes the brain, it becomes like toilet water. Remember, you've heard me say many times, 70% of the fluid inside the brain is in the venous system. The venous system drains through the internal jugular veins, which sit right on the anterior cervical vertebrae. So if you get ligament injury or ligament laxity, and again, you could hit your head, you could be in a car accident, you could fall down, you could be in sports and get your head smashed, you could be an MMA fighter. We've had a few of those in the clinic. You know, all those things can injure the ligaments of the brain, ligaments in the neck, and that can eventually cause an extra movement of the vertebrae, which can obstruct the jugular vein. Ultimately, the neuron, Purkinje cells, the various neurons of the brain actually die because of the increased pressure. So basically, a clogged brain toilet, because of cervical dysstructure, breakdown of the cervical curve from ligamentous cervical instability, causes an increased pressure in the brain. And then eventually, beside just essential tremor, instead of being happy, joyful, you end up getting brain fog, you feel dumb, you can get a loss of mental capacity, and basically problem solving becomes a problem. This basically shows how just a simple face down lifestyle can stretch the posterior cervical ligaments. You get a reversal of the curve, which we term cervical dysstructure. Basically, the toxic metabolites accumulate in the brain, and eventually you can get brain neuron cell death in the cerebellum or other places in the brain. And depending on what part of the brain's affected will determine what symptoms, right? So somebody could have visual distortions if the part of the brain that has to do with vision. They can have hearing problems if the part of the brain that has to do with hearing. The part of the brain that has to do with movement, which we talked about, the thalamus, basal ganglion. The substantia nigra is affected in Parkinson's. The cerebellum's affected in essential tremor. So depending on what part of the brain is affected by the increase in pressure will determine the symptoms. And then if somebody has severe joint instability, the treatment's prolotherapy. If they just have vertebral malalignments and a curve problem, physical therapy, exercise, chiropractic care such as orthospinalogy or upper cervical adjusting, very low force adjusting, sometimes can have dramatic results. And then what we typically find when somebody comes here is they've had a breakdown of the cervical curve, and they have a lot of instability. So a combination of some type of exercise, prolotherapy, and we work very closely with various chiropractors. This just shows prolotherapy. So prolotherapy, injections to the various ligaments that are involved in the instability. You might say, well, how do you determine the instability? In the office, we do an upright cone beam CT scan, which will show the 3D anatomy. And we do a digital motion x-ray. It's actually an upright motion x-ray that will show the instability, and prolotherapy is done where there's instability. Often the whole neck's done, just because there's typically multiple areas that are involved with the instability, not just like the upper part. Now, for essential tremor, depending on the severity of the case will determine how many visits. A typical course of treatment might be 6 treatments. give or take a few treatments over the course of 5 to 8 months. Takes a while to restore the curve and restore the instability, but many people have been told that there's nothing that can be done for essential tremor and other tremors except medications and deep brain stimulation. But I'm just here to tell you that often the cause is intracranial hypertension, which can be treated by restoring the fluid flow out of the brain, by restoring the cervical curve and stabilizing the neck with prolotherapy. Peg, what made you decide to come to Caring Medical?
I had been suffering for about 12 years, became disabled, just 22 doctors, no one could diagnose anything except for my B12 had dropped. I mean, I was suffering horribly with it. And
well, what symptoms were you having?
Oh, my vision was going bad. I was having brain zaps, and
explain a brain zap.
It felt like I had a probe, an actual probe in my head and someone would just send electricity to it. And
like it go to different parts.
Different parts.
But you knew it was real deep. It's not your face, it's absolutely the brain.
Yes,
yeah.
Yes. Okay. And then I started having symptoms of what they thought I was having strokes. One side, and then that would kind of get better, and then it was the other side.
You'd get numbness or weakness?
Both.
Okay.
Both. And
but when they would do MRIs of your brain, it didn't really show much, right?
No, they did find a small lesion in the area of the pineal gland, and I went to a neurosurgeon, and they found that my B12 level was like at 20.
Okay.
And I was, basically I had no control over my body movements at all.
Like you were under stress all the time?
That or like somebody, like I'm seizing all the time. I was just like this all the time. All the time.
And you couldn't do anything about it?
Nothing. Okay. Nothing helped.
When they gave you B12, they started doing B12 shots or sublingual?
B12 injections. They started with the cyanocobalamin, and then I reacted badly to it. So I do compounded methylcobalamin.
Okay.
And that started, it did help.
Okay.
But I still continuously had just, if I put my arms out, I would like this, zombie-like, if I could get my arms up.
Okay.
And in talking with people, I couldn't get, my lips would quiver, my face would quiver, and then I was...
So even just for you being here talking the way you are, that it's basically been the improvement in the last 3 or 4 months, right?
Oh,
like
absolutely.
It's been dramatic. Like
dramatic.
People would see you now and say, like, what is the lady talking about? Because she seems totally fine.
Fine. They think that. Exactly.
What made you think like we could help you? And tell the audience the gestalt of your symptoms, like that you had 4 months ago.
I could hardly walk. I came here basically wheelchair bound, and I was, a year and a half ago, 2 years ago, I was either asking God to take me.
Like you just wanted to end your life.
Wanted
you felt
over.
So bad.
Oh,
you felt so bad.
Oh, I could hardly see.
So terrible vision.
Terrible vision, my hearing, even silence. Silence was deafening.
Okay, explain that. How is silence deafening?
Hearing anything sometimes, just oversensitive.
So you had sound sensitivity.
Bad sound sensitivity and
bad light sensitivity.
Yes. Okay. In fact, on my first treatment here, my very first treatment, Stephen was with me.
Your son.
And yeah, my son Stephen was with me, and as Demi helped roll me over after the injections, and like my eyes were wide open. I was always walking around like this because I could hardly stand it, and everything visually in my world was moving around me and foggy. And I rolled over, and my eyes were wide open, and he said, "Mom, you understand?" I mean, my color came back because I was so pale. I was so excited because I didn't have to squint. The sunshine didn't make me feel like my eyeballs were burning or my brain was on fire. And I knew right then that this was the way. And I found you just by the grace of God.
Okay.
I had I've got 14 prescriptions for anti-anxiety, depression, whatever. But I sat down, I've been my biggest own advocate because all of them say there's nothing wrong with you. They finally found a kyphosis.
Okay.
And I said, and my neurosurgeon said, wherever you want to go, whatever you want to do, because I believe this is bigger than just B12.
Oh, so they were,
Just.
he was wise about that.
He was, and he said,
Okay.
but he admitted, I don't know because
Okay.
your MRIs. So I went home, and at that point when I was like, okay, God, you're either going to take me or you're going to help heal me, or you will heal me. I mean, I'm at this point, I have my son, I have so much to live for and
Yes.
to offer.
Yeah.
So I got on the computer, and even with those tremors, I could hardly write. I couldn't.
Why don't you explain, like, when you came here, what would it have been like? What would the audience have seen?
Oh,
like-
I would just,
Like, you're always like going like this.
yeah,
And then,
or my head, or you'll see the skin on my neck quivering,
yeah, like,
or,
and then the arms were like shaking. Like the whole body was shaking.
yes,
But
the whole
mostly
body.
the arms and the
yes,
head.
and the head.
Like if you were
and-
at a restaurant, people would absolutely notice you because you're
Yes.
shaking so much.
Yes, and I couldn't hold on to things, like,
Yeah.
and it would take me, I would have to really concentrate on getting pen to paper.
Yeah.
And then once I got it there, it was difficult to make it
Yeah.
any kind of just scribble. So, and internally, I say it's like having a loose ground. Internally, everything was arcing all the time.
Yeah. Explain that though. What does
Well,
that mean?
What was going on outside was going on inside.
It's almost like
constantly.
your whole electrical supply of your whole
Yes.
body was off.
Yes.
Like, we just had the hurricane and everybody's electrical system is like all haywire. So, and then, obviously on the internet and the YouTube videos, I talk a lot about the vagus nerve and I talk a lot about the neck. Was there something once you saw the videos that you thought, well, maybe it's the neck?
Everything.
Okay.
I
So,
went back and started watching everything because
Yeah.
and it was the vagus nerve one
Okay.
that first popped up, because it would get worse. I would drop to the ground if I brought my arms up.
Okay.
And no one could tell me why. So all I did was Google dizziness and fainting with arms up. There you were.
Yeah.
There you were. And
Depending
I
on
was
your
like-
instability, yeah, your neck even changes sometimes because of arm motion.
yes. And I started crying
Awesome.
because I knew it was God answering me. And then when you accepted me and I did my interviews and reached out, and before I got to you, I had found Dr. Shortino because I didn't know how I would get to you. So I thought, well, I've got to start what I can.
Yeah.
Got the DMX, and then found Dr. Derek, who's my upper cervical chiropractor, and he's all about you.
Thank you so much.
Yes. And he was like, he did everything he could to
Yeah.
start, but he helped me understand that it's possible. And then listening to you, I knew it was possible. And every video, it's like, ooh, Dr. Hauser's talking to me.
If we think about essential tremors and brain zaps, the most logical explanation for them is going to be that the brain pressure is so high.
Yes.
So, like, one of the things, part of it I just wanted to show people, because you're so different than when I first saw you.
Yeah.
Like, you're basically, getting back to normal. Like, you're
Yes.
getting back to normal. So if we looked at your optic nerve sheath diameter, so like see where it says here when we started it was 8.2 and 8.2. And then the last visit when we retested you, it went from 8.2 to, where is it here? Oh, here it is. Okay. See where it says 8.2 and 8.2. Then after 2.5 months, it went to 6.1 and
Yes.
7.0. So it just means like the amount of fluid around your eye nerve, it's way, way less. And then it's correlated with, you know, your improvement. And
Yeah.
obviously we've done a bunch of work on your curve and done prolotherapy.
Yes.
And your jugular veins also are opening up. So your brain pressure's going down. And it is possible just with one prolotherapy visit, because you get so much tightening here. So it is possible that even that first visit changed your structure enough, even if it's just 1 millimeter, that, you know, your pupil diameter went down enough that, you know, you didn't have that light sensitivity anymore.
It's amazing. And the tremors too, they made me feel more unstable all the time because my body just was doing what it wanted to do.
How far can you walk now? Because you couldn't walk at all when you came in.
Yeah, I can do maybe 100 yards. I mean,
So that's
and
good.
to me, that's like running a marathon.
That's awesome.
I know it's not your marathon type running, but but literally, and I'm looking forward to driving again.
Awesome.
I'm looking forward to most importantly, I look forward to coming here.
No, but I mean, you know, like getting back with your life.
Yes.
What do you think you're going to do, like, once you're healthy? Like, you know, because you were in such a bad state. It's almost like God's giving you the gift of health back.
Yes.
Like, has he put anything on your heart of what you want to do?
I've been in the medical field since 1989. But now, and I love giving of myself to others, serving others. So I'm going to get out there and do more of that. Volunteering, getting involved in the community, more in the community, not so worried about all the other things that don't really matter.
Good. Yeah, it's like getting your priorities straight.
Yes.
Like every day is a gift. We shouldn't take any day for granted. So why don't you just go through, like, what are all the symptoms that have improved? Like you said, your essential tremors, like way, way better.
Yeah, like
now
90%.
You can write. Yeah, now
yes.
you can write. And then probably the head pressure is way better.
It is. My involuntary motions are coming back. They're becoming involuntary again.
Okay.
I can now brush my teeth in less than 10 minutes.
Okay, good.
My proprioception, much better.
Your balance.
My balance is much better.
Vision is probably better.
Yes, yes. And I still have times where I can feel the inflammation, so I have to really take care of, I mean, I've changed my diet.
How many treatments?
4. Today will be my 5th.
Yeah, how many did I say when you first came? Do you remember?
You weren't sure. You told me I was really complex.
Okay.
And I knew that.
Usually I give you a number, but
yeah,
there are going to
you said 4 to 8.
Okay, okay.
Yeah.
Digestion, is that better?
It is. It's getting better.
Okay.
Yes.
Okay.
And I think the reason is because you sent me back, and I want to tell you that is one of the things I really appreciate is that you sent me home to get more testing, and that's when we found the ectopia.
Yeah. You have like cerebellar tonsillar, just because it was so severe.
Yeah, brain pressure.
What I'd say is maybe in like 4 months we recheck the MRI and see if the ectopia's gone.
I'd be excited.
Because it should be, you know, if the brain pressure's down, the brain should get sucked back up into where it's supposed to be.
So is that what's happening? I can feel that.
Yeah.
Yeah.
I
think I can feel that.
Yeah. And you can understand if parts of the brain, like here, we'll just do this. So if parts of the brain are in this hole, you could also see where that could plug up the cerebral spinal fluid. And that could also give brain zaps. You know, because there's actually the brain sinking into a hole that it shouldn't be sinking into.
Yeah, and we did educate some people on the plane coming here.
Oh, awesome.
I've handed out 5 of your cards too to people that look like they need you.
Thank you so much.
You're welcome.
Thank you so much.
You've all been a real blessing. But yes, some of the other things that have proved, my tinnitus. Almost gone. And when I said the silence is deafening,
Yeah.
there were times that I wanted to not have ears at that point. It just would constantly, in different tones, and
The tinnitus was what was bothering you when it was silent, because it was just
yes,
it was just overwhelming.
overwhelming. And if a car, even the smallest sound, it came across as though I had these like Bose speakers in my head, and it was horrible. And that's almost gone.
You never had it where your own voice was so deafening. Did you ever have
Yes.
that? Okay. Because some people have that.
I didn't want to talk.
I haven't had it like so severe, but I've had it. I know what that is, because I've had that where all of a sudden my own voice was like way louder than it normally is.
And Stephen's told me in the past, Mom, you're yelling.
Okay.
And I'm like, well, but I didn't think I was.
Probably your hearing's
the
better
opposite.
too, right? Your
Yes.
hearing.
Yes.
Is there anything else that's better? I mean, we said walking, digestion, the heart arrhythmias and everything. Is that better?
It is
Okay.
much better. The other thing I found was my limbs would do, I called it dysautonomic Tourette's of the limbs.
That's a good term, dysautonomic Tourette's.
Tourette's.
So
of my
explain
limbs.
what you used to do and you don't do it anymore.
Okay, I would be walking and my leg would just kick out
For no reason.
for no reason, or it would stop. I would actually shuffling,
Okay.
because that's really how I felt comfortable and was protecting myself.
Yeah.
So I'd be shuffling and one leg would go and the other would just not, like it wasn't there. It would just stop. And the same with my arms. The dog and the cat loved it though. If I was trying to fix something, I might fling it.
Okay.
So, I mean, and I would fling food, or I would just go to reach for something, and I'd start and it would just go wherever, and my arms would do that all by themselves, and my hands and my fingers.
And that almost is completely
That's
gone.
almost gone, and I've started getting feeling.
Yeah.
I thought it was a blessing to have a high tolerance of pain. What I did not realize was my body, I wasn't getting the thing. And so
You weren't
now when
feeling
I
things
get,
like you should.
yeah, like I would burn myself and not even know it. And then, or I could smell the skin, or I go to wash my hands or something, and then it would hurt then. But every time now that I get a little cut or a little something and I feel it, I am like, praise Jesus.
That's awesome.
And I don't say that lightly.
Awesome.
So I'll keep coming back. I'll be here about every 6 weeks just to say hi.
Well, I appreciate it. And I was just thinking, since Stephen's here, it'd be kind of interesting to have me just talk to him a little bit.
Okay.
Just to, from a son's standpoint.
Yeah.
But no, we just appreciate you sharing your story and look forward to you getting
Thank
100%. And
Me too. And we're going to dance.
okay, awesome. Okay.
We're going to do a dance on my
well,
graduation day.
Okay, that's awesome. Okay, we'll take a video of that.
Okay.
Stephen, you live with your mom, right?
Yes.
And you guys are in Wichita.
Yeah.
Do you work full time?
I do.
Like, it would have had to been pretty awful for you, right? To watch your mom like she sounds like she's a very vibrant lady to get like hopeless, right? Your mom's like normally a tower of strength.
Right. And to see that start to crumble through time, it was tough to see. It was hard to show any like emotion towards it because she already had enough to deal with. You know?
Right. So you just tried to be strong for her.
Whatever she needed.
You probably prayed a lot for her too, right?
I did.
Was there a time where you said like, geez, you're not even sure she's going to get better, right?
There was a point. There was a point where there was no coming back. And then when she started talking about finding you and the possible trips to come down here, it was exciting, but it was always
Kind of skeptical too.
very
like,
skeptical.
I don't blame
you.
you. Like, especially like she couldn't find like a guy with a tie. Wasn't that kind of funny when you saw like, you want to go to that doctor? Like that doctor is going to be like, you know what I mean? Like you guys went to all the medical centers and everything.
It was probably more comfortable to see not a suit and tie.
Okay.
A guy that you know, is all excited and wants to be helpful and not just, hey, come sit in this chair all day and get treated on, you know.
I always think it's encouraging, like for instance, like imagine, well, maybe just explain, like you're here for your first visit, and then my team, myself included, we're going through all the test results, and this is wrong, and that's wrong, and this is wrong, and then it can get corrected. Did you guys get really hopeful then?
I know she did for sure. I still was skeptical.
Okay, that's fair.
I was skeptical pretty much all the way up till she started seeing the results.
Okay.
Because paper, you know,
got you.
injections is all fine, but...
That's fair. Well, when did you know she is getting better? Like, when was the aha moment? Like, where you went from a skeptic to a believer?
Well, like she said, though, is when she would... It's like, so you would see her get out of the couch, just right on up. You know, stop the shakes. She would, and then being just excited, the smiles, the playing with the kids around, you know, like the cousins' kids and stuff. It started real, started real early. So, I don't know, it's kind of hard to explain.
Like after a couple of visits,
I'd say visit 3, I started seeing
Okay,
a lot
okay.
of differences.
Okay. So you're convinced now, like I'm a doctor, and like she's getting
I'm
better.
100%
like we're
convinced.
like
I start to get excited now. So yeah.
it was worth it to interview you here just for that, because I didn't know like you were a skeptic.
Yeah,
so that,
100% skeptic until I see, for me, until I see physical results, paper results don't.
Yeah, and you probably appreciate it too, like even from the get-go, because she was so disabled. Even me, with all my experience and my team, it's like, we got to do some other tests, and we got to, that probably, from a skeptic standpoint, I'm like, that doctor, like, you know.
It was nice to hear it wasn't just writing the treatment. It wasn't say, you know what, oh, well, here we go, we're just going to do this, you know. Yeah.
And then obviously we told mom, you know, what position to sleep in and things to do. And then, so it's probably made your life better, huh? We're living with mom, like you don't have to do as much now, right?
No, I got my chore list still. Okay. So yeah,
oh, that's good.
Yeah,
she's cool though. What a neat lady, isn't she?
She is. She's great.
So just appreciate you sharing your perspective and everything.
Thank you.